Understanding acute myeloid leukemia, AML, signs, symptoms, and treatment. Acute myeloid leukemia, AML, is a type of cancer that starts in the bone marrow and affects myeloid cells, which are a type of white blood cell that normally develop into red blood cells, white blood cells, and platelets. AML is characterized by the rapid growth of abnormal white blood cells that accumulate in the bone marrow and interfere with the production of normal blood cells. Here's a comprehensive look at the causes, signs, symptoms, and treatment options for AML. Causes of acute myeloid leukemia, AML. 1. Genetic factors. Genetic mutations. Changes in specific genes, such as FLT3, NPM1, and CEBPA, can increase the risk. Chromosomal abnormalities. Genetic disorders involving the chromosomes, like translocations or inversions. Family history. A family history of leukemia or genetic syndromes such as Fanconi anemia and Down syndrome. 2. Environmental factors. Radiation exposure. High levels of radiation, such as from nuclear accidents or certain medical treatments. Chemical exposure. Contact with chemicals like benzene and certain pesticides. 3. Previous cancer treatments. Chemotherapy. Certain chemotherapy drugs used to treat other cancers can increase the risk of developing AML. Radiation therapy. Prior radiation treatment can contribute to developing AML. 4. Blood disorders. Myelodysplastic syndromes. Disorders affecting blood cell production can progress to AML. Polycythemia vera and other chronic conditions. These conditions can transform into AML over time. 5. Age. AML is more common in older adults, particularly those over the age of 60. 6. Smoking. Tobacco smoke contains chemicals that can cause DNA mutations leading to AML. Signs and symptoms. 1. Bone marrow suppression, anemia, fatigue, weakness, pallor, and shortness of breath due to a lack of red blood cells. Leukopenia. Frequent or severe infections due to a lack of healthy white blood cells. Thrombocytopenia. Easy bruising, bleeding gums, frequent nosebleeds, and prolonged bleeding from cuts due to a low platelet count. 2. Systemic symptoms. Fever. Persistent or recurring fever without a clear infection. Unexplained weight loss. Significant weight loss without changes in diet or exercise. General malaise. A general feeling of discomfort, illness, or uneasiness. 3. Bone and joint pain. Bone pain. Pain or tenderness in the bones or joints due to bone marrow expansion. 4. Swelling in enlarged organs. Lymphadenopathy. Swollen lymph nodes in the neck, armpits, or groin. Hepatosplenomegaly. Enlarged liver or spleen causing abdominal discomfort or fullness. 5. Neurological symptoms. Headaches. Persistent or severe headaches. Neurological changes. Symptoms such as confusion, dizziness, or balance problems if leukemia cells spread to the brain or spinal cord. 6. Skin and gums. Petechia. Tiny red spots under the skin caused by bleeding. Chloromas. Solid collections of leukemia cells under the skin or other tissues. Gum swelling. Swollen, tender, or bleeding gums. Treatment. 1. Chemotherapy. Induction therapy. Initial intense treatment to achieve remission by rapidly reducing the number of leukemia cells. Consolidation therapy. Follow-up treatment aimed at destroying remaining leukemia cells and preventing relapse. 2. Targeted therapy. FLT3 inhibitors. Drugs like midostaurin for AML with FLT3 mutations. IDH inhibitors. Ivosidenib and edasadinib for AML with IDH1 or IDH2 mutations. 3. Stem cell transplant. Bone marrow transplant. Allogeneic transplant. Stem cells from a matched donor to replace the diseased bone marrow. Autologous transplant. Using the patient's own stem cells after high-dose chemotherapy. 4. Radiation therapy. Targeted radiation. To treat specific areas affected by leukemia or as part of the stem cell transplant preparation. 5. Immunotherapy. Monoclonal antibodies. Drugs like gemtuzumab ozogamicin targeting specific proteins on leukemia cells. Checkpoint inhibitors. Immunotherapy drugs that help the immune system recognize and attack cancer cells. 6. Clinical trials. Experimental treatments. New drugs and therapies under investigation for AML treatment. 7. Supportive care. Infection management. Prophylactic antibiotics, antifungals, and antivirals to prevent infections. Blood transfusions to treat anemia or low platelet count. Growth factors, medications to stimulate the production of blood cells. Acute myeloid leukemia, AML, is an aggressive and complex cancer that requires swift diagnosis and treatment. Understanding its causes, recognizing the signs and symptoms, and exploring the various treatment options can help manage the disease effectively. Early intervention and comprehensive care are crucial for improving outcomes and enhancing the quality of life for those affected by AML. Stay informed and proactive in managing AML to achieve the best possible results.